Hi, my name is Rich. I'm a level 1 nursing student.
Hi, Rich.
How are you today?
I'm good. How are you?
Do you mind if I shadow you today?
Yeah, that'll be fine.
Okay, great. Can I get an S-bar on your patient?
Sure. I'm getting ready to go in to see Miss Marta Yarn. She's an 80-year-old female in room 529. She was admitted Tuesday from her physician's office, and that's Dr. Jolly, for a non-healing sacral ulcer. She has no known drug allergies, and she is a full coat. She's 175 pounds and 5 foot 5 inches. The patient has a history of multiple admissions for dehydration and pneumonia, and she was last admitted 6 months ago. She does not smoke. She has no history of heart disease or other chronic illnesses. Her last vital signs were temp was 99.1, blood pressure was 144/90, pulse was 88 beats per minute, and her O2 saturation was 92%, and that was on room air, and her respirations were 24 per minute. Her pulses, her peripheral pulses are 2+ all around. She has no edema present and a normal S1, S2. She's also a normal sinus. Her lung sounds were diminished in her bases, but otherwise they were clear. Let's see. She's verbalized a decrease in appetite, but has no complaints of nausea, vomiting, or changes in her stools. Her abdomen was soft and non-tender, and it was active in all 4 quadrants. She's slightly hard of hearing and has limited visual acuity, but otherwise she's pretty well intact. She's alert and oriented ×4. She's a regular diet right now, but she will be NPO after midnight because she's going in for a debridement tomorrow morning. She's complained of occasional stress incontinence with nocturia, but denies pyuria, hematuria, and vaginal bleeding. Her intake right now was at 350, her intake was 850 and her output was 350. So we need to see what's going on there. She does have a right dorsal metacarpal IV that was inserted earlier today. She is receiving continuous fluids. She has complained of dry, scaly skin and has poor skin turgor, so it sounds like she's a little dehydrated. Her skin is intact with the exception of that stage 3 pressure ulcer, which is 4 centimeters by 4 centimeters by 1 centimeter. The breakdown started about 6 months ago, and it has been treated on an outpatient basis without success over the last 3 months. She's widowed, lives alone in a senior housing apartment, has 2 children that both live out of state, and she rarely sees them. Her medications that we're going to be giving today are gentamicin and normal saline with 20 milliequivalents of potassium chloride. Her lab work was sodium was 145, potassium was 3.6, so it was on the low end, but it was still within normal range. Her BUN was 22. Her PT did come back a little low at 11.8, and then her white blood cells were increased at 12,500. We ran a UA on her earlier, and it came back clear, but it was an amber color, and it was positive for proteins with 11.6 milligrams per deciliter.
Okay.
We also did a culture on the sacral wound itself, and that came back positive for E. coli, which I'm sure you know is a gram-negative rod.
Oh, yes.
We have a chest x-ray pending and an ECG pending results. But in the meantime, we're going to go ahead and hang that gentamicin and get those IV fluids started for her, so that way we can tackle that dehydration.
Okay. Thank you for the excellent, thorough S-bar.
Thank you.
So why specifically is this client receiving the medication?
Well, her lab work was indicative of infection, specifically that culture, which was positive for the E. coli. Her white blood cells were also elevated, which you see with infections as well.
Okay.
And then with the potassium, while her level was in normal range, it was on the low end, and she is showing those signs of dehydration.
Okay. So what action do these medications have on the body?
The gentamicin is an anti-infective. What it does is it irreversibly binds to the 30S ribosomal subunits, and this binding interferes with the formation of messenger RNA, and the subsequent formation of non-functional proteins and the eventual death of those susceptible bacteria. And then the potassium chloride helps to maintain an acid-base balance, isotonicity, and electrophysiologic balance of the cell. It's an activator in many enzymatic reactions. It is essential to transmission of nerve pulses, contraction of cardiac, skeletal, and smooth muscle, as well as gastric secretion, renal function, and tissue synthesis and carbohydrate metabolism.
Oh, wow. Okay. Okay. When would you question administering this medication?
With the gentamicin, you would question administering it if she wasn't showing signs of infection or if she had a hypersensitivity to gentamicin or any other aminoglycosides. You'd also want to use caution in patients that have renal impairment or or hearing impairment like she does. So we're going to be monitoring her hearing pretty closely.
Okay. Okay. Does this medication have a therapeutic serum level?
The gentamicin, its therapeutic serum level is 8 micrograms per milliliter, and then the potassium chloride you want to keep between 3.5 and 5.
Okay. Okay. Which vital signs should be monitored for these?
You really want to monitor all of her vital signs with these medications.
Okay. Okay. And which physiological parameters should be monitored when the medication is being administered?
With the gentamicin, you're going to want to monitor her renal function by monitoring her urinalysis, specific gravity, BUN, creatinine, and creatinine clearance rate, both before and throughout therapy. You also want to monitor her intake and output and daily weight to assess hydration status and renal function, and you're going to assess for signs of superinfection like fever, upper respiratory infection, vaginal itching, discharge, and increasing malaise or diarrhea. And then additionally, you're going to monitor or evaluate that eighth cranial nerve function by doing audiometry before and throughout therapy. And you're going to monitor her vestibular dysfunction, which is going to show signs like vertigo, ataxia, nausea, and vomiting.
Okay. Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You're really going to want to teach them what medications they're receiving and why they're receiving that medication, also what the medication looks like, as well as some of the side effects of the medication.
Okay. Now, what about in the home setting?
Typically, you're not going to be giving these medications in the home setting because they are IV medications, but you're going to want to make sure or to teach the patient about different signs of infection such as fever, chills, and general malaise.
Okay. What are the side effects and potential adverse reactions to these medications?
With the gentamicin, you're going to be watching for ataxia, vertigo, ototoxicity, nephrotoxicity, muscle paralysis, and hypersensitivity reactions. And then with the potassium chloride, the most concerning adverse reaction is going to be arrhythmias. You could also see signs like confusion, restlessness, weakness, ECG changes, or irritation at the IV site, and paralysis or paresthesia.
Okay. Okay. And how will you know the medication is effective?
We're going to start to see resolution of the signs and symptoms of infection, and if there's no response within 3 to 5 days, then a new culture should be taken. Also, with the potassium chloride, you should see the serum potassium level start to stay at a normal range.
Okay, great. Well, those are all the questions I have for now.
Okay. Well, let's go ahead and go in and see Ms. Yarn.
Okay.
Come in.
Hi, Ms. Yarn. I'm Annie. I'm your nurse today. I've got a student nurse, Rich, with me that's going to be watching while I give you some medications. Is that okay?
That's all right.
All right.
Hi, Mrs. Yarn.
How are you?
Good. How are you?
Very good. How's school?
Very difficult.
And,
Well, how are you doing right now?
I'm all right.
Okay, good. I'm glad to hear it. I'm going to be giving you some antibiotics today as well as some IV fluids. We're going to give you some potassium chloride in a normal saline solution to help with that. It sounds like you've maybe got some dehydration. And then we did run that culture on your wound, and it came back positive for an infection, so we're going to go ahead and treat that with the antibiotics.
Okay, all right.
Now, first things first, can you do me a favor and verify your name and age?
My name is Martha Yan. I'm 80 years old.
All right, thank you. And do you have any allergies that I'm not aware of?
No, I don't have no allergies.
Okay. I didn't see any in your chart, so I just wanted to double check and make sure. Before I pull out the medication, I want to take a look at your IV site and make sure that it's working like it should be.
Okay.
Are you having any pain or anything at the IV site?
No, no pain.
No
pain.
redness or swelling?
No, no.
Okay. I'm going to go ahead and flush it with some normal saline just to make sure that it's flowing like it should be.
Okay, that's all right.
And I'm sure you've heard to clean it like you mean it. That's what I'm doing with the hub right now.
Oh, yes. They talk about that all the time in level 1.
Are you experiencing any pain when I inject the saline?
No, I just feel cold.
Okay, that's normal. But it looks like it's flowing like it should be, which is good. Alright, Rich, the first thing that I'm going to do is I'm going to go ahead and get my tubing together so that I can hang the IV.
Okay.
What you want to do is when you take the tubing out, you want to make sure that the packaging is still intact, which it looks like it is. And as we take it out of the packaging, the first thing that I'm going to do is I'm going to make sure that the roller clamps are closed.
Okay.
You also want to go ahead and put a label on the tubing. We do change the tubing every 72 hours here, so you want to make sure that it's labeled with the date, time, and your initials.
Okay.
Got both of these labeled. So I'm going to go ahead and get my medications together. And you want to double check the medications against the order. So you want to make sure that you've got the right medication, right patient, that it's being delivered by the right route at the right time with the right dose.
Okay.
I'm sure you've heard about those 5 rights.
Yes.
So I've got the sodium chloride with 20 milliequivalents of potassium chloride in it. I'm going to check the bag, give it a little squeeze, make sure that there's no leaks in the bag. Look, make sure that it's clear, not cloudy. And it should be nice and clear, not any different colors.
Okay.
I want to make sure that I've got the right medication here and that the expiration date is still within parameters, which it is. I'm also going to check the medication. I've got the gentamicin. Now that could be a little cloudy because it was mixed by the pharmacy, which is okay. But you want to give it a little squeeze, make sure that there's no leaks. Check for the color. It should be kind of a clear color. Shouldn't really have much color to it, but like I said, it could be a little cloudy. And again, check the expiration date. And check that against your orders. And I've got gentamicin, 80 milligrams in a 100 milliliter bag, which is what I've got here. All right. Now, before we get going, Ms. Yarn, can you go ahead and verify your name and date of birth again for me?
My name is Marayan. I'm 80 years old.
Okay. Let me get my medication scanned in. And one more time for me.
Matayan, 80 years old.
Perfect. And I've been given the green light to go ahead and administer these medications, so I know that I'm good there. Now, what I'm going to do next is I'm going to go ahead and spike my bags and get them ready to hang. Now, this is a sterile procedure, so you want to make sure to keep the spike itself from touching anything else because it is sterile as well as the inside of this bag.
Okay.
So since it goes directly to the patient, you don't want any contaminants in there.
Okay.
And you use a shorter one for your small bag or your piggyback. fill the drip chamber about halfway. And I'm going to do the same thing with the larger bag, the normal saline with the potassium chloride. Being sure to make sure that those ends are sterile. I'm going to fill that drip chamber about halfway. And I'm going to go ahead and grab, we've got a different hanger that we use for the larger bag that'll actually keep it lower, which helps gravity to infuse the smaller bag or the piggyback first. Get my trash can over here next to the bed so that I can prime the tubing. Make sure that there are no kinks in the line. And we prime the tubing to make sure that there's no air in the line itself.
Okay. So my primary is ready to go. I'm going to go ahead and prime my secondary bag. You want to make sure to do that a little slower because you don't want to waste any of the medication itself. I'm going to go ahead and connect my secondary bag to my primary line. And again, we're going to clean the port, clean it like we mean it. Okay.
I'm also going to clean the hub here. Alright, Ms. Yarn, I'm just going to go ahead and hook this up to your IV site for you. I'm going to set my rate, just compare it one last time to make sure that I'm infusing this correctly, and that's 125 milliliters per hour. And I like to set the volume to be infused a little short of the 1,000 milliliters that are in the bag, so that way the alarm goes off before it's actually empty and we can come back and change out the bag. I'm going to set up my secondary line. And it's just verifying that the 80 milligrams per, or 1,000, or excuse me, 100 milliliters is what I want to infuse.
Okay.
And that is correct. And we'll infuse that at a rate of 1 hour. And what we're watching for is that we're going to see 5 drops in this chamber. Oh. I want to make sure that my roller clamps are open, otherwise we're not going to see anything.
Well, there's the drops.
There's that 5 drops that we
Okay.
were looking for, so that's good to go. So I'm just going to go ahead and document what it was that I gave. Now, Ms. Yarn, if you start to have any symptoms of allergic reaction, like if you start to feel any itching or if you start to feel dizzy at all, please let me know.
Okay.
You might feel a little weakness, a little fatigue. And if you do, please let me know that as well.
Okay.
What we're really watching for, though, is we want to make sure that your hearing is okay. So if you have any ringing in your ears or you start to feel dizzy, like I said, please let me know immediately.
Okay.
I did bring you some information on the medication itself for you to review. And if you have any questions, I'll be happy to come back later and answer those for you.
All right. Thank you so much.
You're welcome. And I've got your call light here for you, so if you need anything else, you please feel free to call me.
Okay.
Otherwise, I'll be back to check on you in about 30 minutes.
Okay, sure.
And you know, the last thing I wanted to ask you before I go, how's your pain right now? I know that we gave you some Percocet earlier.
No, right now I'm okay. Probably 1.
A 1 on a
Yeah.
scale from 0 to 10?
Yeah.
Perfect. That's what I like to hear. Well, we do have some additional medication, so if your pain starts to increase at all, please, call me and I'll come back and give you some additional medication.
All right. Thank you.
All right. Looks like we are all set. You take care, Ms. Yarn, and I'll see you shortly.
All right. Thank you. All right, Richard. See you.
Okay, thank you.
Wasn't too bad.
No, that was very, very informative and interesting. Thank you. I just have some additional questions, if I could ask.
Okay.
Okay. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Well, I did check her lab values, her most recent lab values, to verify the signs of infection, and I also checked to make sure that her kidneys were functioning as expected. The other thing that I checked was the Y-site compatibility of the 2 medications to make sure that when I was giving that gentamicin that it was compatible with the potassium chloride.
Okay, okay. Did this information affect your decision to administer the medication?
It did. It actually let me know that it was safe to go ahead and give that medication.
Okay. And did this information affect how you administered the medication?
No, not really.
Okay. Well, those are really all the questions I have.
Okay.
So, again, thank you very much for letting me watch.
You're very welcome, Rich, and you take care. Good luck in level 1.
Thank you very much.